I'm Dr. Carabulea. I'm a medical oncologist. I've been practicing medical oncology and hematology for 20 plus years. This pandemic has, as you know, has affected the way we provide care, in particular cancer care, to our patients from the provider's perspective, from the pharmacy perspective, and we've been making adjustments and coming up with innovative ideas to provide the best care we can under the circumstances. I think we need to reaffirm and reassure our patients that everything we do with the hope that our patient will be safe, will receive the appropriate care, and we always patient safety is always and will be of paramount importance to us. The cancer care during the pandemic is changing, and this is changing in many ways. One way is accessibility to care. Patients are afraid of coming to the office. They are afraid of getting out of their houses for their appointments. A moment ago I mentioned about patients being fearful of getting out of their house and coming to the office, and obviously I was referring to fear of contracting COVID-19. Fortunately, in the area where we practice in Orange County, we have not had as many cases as elsewhere. That's good news, and I'm trying to reassure our patients that the risk of contracting the infection, COVID-19 infection from us or other patient in the office is very, very low. And we're sharing our measures, that everything we have done and we are doing to minimize the risk of infecting others or getting infected by people who are infected in the process of delivering care. We encourage good hygiene, washing hands, social distancing, staying healthy, keeping the immune system strong through healthy lifestyle, physical exercise, good nutrition, adequate sleep, all these forgotten secrets of staying healthy and keeping your immune system strong. So we encourage everyone to wear a mask, particularly when they're coming to the office. We will check their temperature and ask a few questions to make sure they have not been sick, infected, were in contact with anyone known to be infected with COVID-19. We ask all these questions before they step into the office. We also change the scheduling pattern. We allow adequate time for each individual patient to be seen and receive treatment with minimal overlapping with other patients. We also have individual infusion rooms. So we have one patient per infusion room, and this is promoting social distancing also is very reassuring to the patient. So with all these minor changes to our daily practice, we are not only providing reassurance to our concerned patients, but also keeping them safe and decreasing the risk of getting infected to the minimum. We trying to help those who don't necessarily need to see us in person by implementing telemedicine visits. This is an old concept, has not been used extensively until now, and I think that this pandemic is going to be a boost of telemedicine use in healthcare. Many patients are afraid, and they are skipping appointments or delaying their visits or delaying screening tests for cancer, and this is definitely a concern. So what we trying to replace this with is helping them have access to us through telemedicine. Obviously, they need the technology, which is pretty popular these days. A smartphone can do it, a tablet can do it. And we haven't had major issues with using telemedicine. I can say 80% of them are very comfortable and they like the idea. Many times these visits are quite adequate for the needs of our patients because not everyone needs a treatment or an infusion in the next couple of days. Many patients are former patients who have been cured or are in remission, have been in remission, and they don't need necessarily a visit in person. Many patients still need therapy, which cannot be delayed, and we still perform those services the old-fashioned way, the infusions in our infusion centers.